Well, thank you so much, and thank you everyone for being here. My name is Blaise Bush. I'm the Executive Director for the LGBTQ plus health program. My pronouns are Blaise and he. Peyton, would you like to introduce yourself?
Sure. Hi, everyone. Thank you so much for being here. My name is Peyton Yen. My pronouns are she or they, and I'm the administrative associate for the LGBTQ plus health program here at Stanford Medicine.
Thanks, Peyton. And huge shout out to Peyton, who organizes all of these talks and all of our newsletters and basically my entire life. So just a shout out to Peyton real fast. And also, happy Pride, everyone. This is our big Pride talk. It's been wonderful to have my first Pride here in California. And it's been an honor to celebrate with Stanford Medicine. And I'm so excited about our talk today. But before we get into that, I do want to let everyone know that you can go ahead and register for our next talk, which will be about the PEACH program and HPV cancer prevention and the LGBTQ plus health program. That's with Dr. Michelle Kahn, and will be Thursday, July 20th from 12 to 1. And I'm posting that in the chat now. And if you would like to receive our newsletters and you are not receiving our newsletters right now, Peyton puts these together. We get a lot of positive feedback. That's where you'll get information about these talks, future talks, and any other kind of events or engagement opportunities for the LGBTQ plus community and our allies and accomplices. I am posting the sign up, I think, for the newsletter there. And now, without further ado, I'd like to recognize our esteemed guest in this wonderful talk. I will say I had never heard of gender expression care until I heard about Monica Prata, and I have to give it to Siggy Javits. I don't know if they're on the call, but Siggy made connections for us. When I learned about this program, I think Peyton and I immediately thought, we've got to feature Monica here with this talk. I think it's a beautiful concept and one that actually don't think gets enough attention or enough people are doing this work. So thank you, Monica, for leading it. Quick read of Monica's bio. So Monica Prata is an internationally known gender expression care specialist. Over the past 15 years, she has supported transgender and non-binary people in expressing their authentic gender identities. In 2019, she received the Gay City News Impact Award, recognizing allies to the LGBTQ plus community, and has been featured in numerous publications lauding her contributions. She designed and leads the gender expression care program for Kaiser Permanente in Northern California. I also just have to say she's a delightful individual, and I know you all are in a treat for today's talk. So thank you so much, Monica, for the wonderful work you do. And now I'd like to hand it over to you. There we go, Monica. We can see you now. We are not able to hear you yet, but you're up.
It looks like I just got bumped from the meeting, but now I'm back. Yay.
Sorry about that. Welcome back. I'm not sure if you missed the end of that introduction, but I was just saying how delightful you are and that everyone's in a treat, and that I'm now handing it over to you to take away.
Well, thank you so much. And if I get bumped again, I'll be back on. It looks like my internet connection is a bit unstable. But thank you all so much for being here today. I'm really excited to speak about gender expression care. It is a new type of transgender care. It's a pretty obvious type of transgender care. And I think that you will see that pretty quickly into this presentation. So we can go ahead to the next slide. So this is a little bit about me. It sounds like Blaise already did a wonderful introduction though, so I will spare you from listening to me introduce myself. Okay, so I'd like to run through a little bit of basic terminology. The majority of you are probably already very familiar with these, but let's go through anyways. So cisgender is when a person's sex assigned at birth corresponds to their gender identity. Transgender is when an individual's sex assigned at birth does not correspond to their gender identity. So oftentimes the word transgender is used as an umbrella terminology, and it includes non-binary or genderqueer individuals, gender fluid, as well as people that are more leaning towards a binary gender expression of masculinity or femininity. Then we have non-binary, which refers to those with gender identities beyond the traditional binary concept of gender, or someone who identifies as neither male nor female. And then we have AMAB and AFAB. So these are pretty common, but they are becoming more and more popular. Specifically, you may see this when you're charting or when you're on Epic, and it's an acronym meaning assigned male at birth or assigned female at birth. This is a really great distinction, that assignment of birth doesn't necessarily align with how somebody identifies, right? So as you're reading this, it is just really essential to remember that it's not AMAB, a male at birth, or AFAB, a female at birth. That key word is assignment, right? Because that has to do with just an assignment and a determination based on somebody's genitals and nothing else. And then TGNB is an acronym referring to the transgender and gender non-binary community. So a common thing that you'll hear me say in this presentation. So before we dive in much deeper, I realized that I did not tell you my pronouns. My pronouns are she, her. And I think it's really important anytime we're talking about a transgender program as a cisgender person, which I am, is to recognize the privilege that I've had to experience a life and a social landscape in which my gender identity aligns with my assignment at birth. That has made things easy for me in many, many ways. And a lot of what you're going to learn today is about how that feeling of incongruence can really lead to so many challenges in somebody's emotional well-being, their safety, their social landscape. And it's really essential to have transgender and non-binary voices being the people that are teaching this work, are leading this work. So the work that you've seen here is a body of work that I've developed over the last 15 years. But my hope that it will be continued forward is that it will be continued forward by people that are members of the community, and that they'll continue refining this and making sure that it is appropriate. So I certainly come into this with my own bias and blind spots, which are a byproduct of where I'm from. And I think as long as any of us who are cisgender and who are working in the transgender and non-binary space can recognize that, I think it's really beneficial to the patients and to the body of work itself. Okay, so back to the presentation. Gender dysphoria, what is it? Gender dysphoria is stress related to feeling discomfort with some aspect of one's body or appearance that is mismatched with their sex assigned at birth. So this is largely the reason for all gender affirming care, right? So when we think about hormones, surgeries, mental health care, support groups, anything like that, right? Those are all services, medical services that are designed to treat dysphoria. The reason being is that dysphoria can lead to many other challenges, many of which I'm sure you already know a great deal about, but the biggest is really suicidal ideation and just attempted suicide. So the trans and non-binary community actually has a 9 times higher rate of suicide attempts than the cisgender population. And that is a really, really massive number of people. So that is 40%. So 40% trans and non-binary people have actually tried to take their own life, as opposed to 4% of cisgender people. Now, 4% is still a really high number, right? That's still devastating. And we clearly have a problem and we need to do a lot about it. But 40% is just such a startling, shocking, heartbreaking number. And really, to me, anytime we focus in on that number and the realities of what somebody's day-to-day experience can be and just how profoundly painful it is, that really gives so much more meaning to this work and any other gender affirming service that you may be offering. So gender euphoria is sort of the opposite of gender dysphoria, right? So it's having profound feelings of joy and comfort that somebody might feel when their internal gender identity aligns with their gender expression. So again, if you are a cisgender person and you have looked in the mirror and you've been like, wow, I look great today, I'm ready to take on the world, that's a feeling of gender euphoria. Right? That's a feeling of alignment and confidence. But again, for people who feel that their body and their face and their presentation is incongruous with their gender identity, they might not be able to have that feeling. And I think when we really dive in, excuse me, when we look inwards,
But
we
I
can
just get to listen because they can't hear us or see us.
Oh,
Make sure there's no camera.
I think we may need to mute somebody. Sorry. Just a reminder to mute if you're not already muted. Cool, and we can go on to the next slide. Okay, so I'd like to talk a little bit about what's going on in the state of California. So we have more and more youth who are identifying as non-binary or transgender. So just in the last few years, we've had more recent publications come out and studies, and this is really interesting. So right now we're seeing almost 2%, which is again, a really high number, almost 2% of adolescents, so people between the age of 12 and 17 in the state of California identifying as transgender and non-binary. Again, we had a really startling suicide rate right underneath. We have 19% of attempted suicide, and 54% of those adolescents have considered suicide. So also in the state of California, 9% of the individuals who were surveyed, they report being denied access to the restroom. Now, this is incredibly important because our transgender and non-binary patients are actually limiting their food and beverage intake to avoid having to use the restroom. So 31% said that because they feared using public restrooms, they aren't eating, they're not drinking complete meals, they're being really, really conscientious around having those healthy habits just to avoid potentially violent and indeed discriminatory interactions while using the restroom. And 55% of those individuals, sorry, we need to mute somebody else too. And then 54% of those respondents also experienced mistreatment from police officers, including verbal harassment, misgendering, and/or physical assault. So again, I think the more we understand about what our trans and non-binary patients are bringing into our medical practices, I think the better we can care for them, right? We really want to have that comprehensive understanding and how that incongruous feeling, that dysphoria really connects to their overall health. Okay, so I want to take a brief pause and hear some patients speaking on their own behalf about some of the challenges that they faced with safety. I also want to give a little bit of a warning. There will be the mention of rape and some other discriminatory things here. So if you're uncomfortable with that, it happens around the 2-minute mark. So just maybe go ahead and mute it. Peyton, we cannot hear.
I was just about to check in with Peyton and see, did you share with share screen with sound with computer audio? You might have to reshare and say share with audio. Thank you, Monica, for patience while we reset and for the little interruptions.
Oh, if I were the person who was screen sharing, we would have so many more challenges. So I'm really grateful that Peyton's sharing for us.
Sorry, can you see now or not yet?
It says that you have started sharing the screen, but we don't see the presentation yet.
Okay, let me try this again.
No worries.
One moment.
In the meantime, does anybody have any questions about the content I've shared so far? Feel free to just take yourself off mute.
For the people that were avoiding bathrooms, like what was the age range did you say for that was? Like, are we thinking this is primarily like school age children, like during school hours, or is this kind of anywhere?
No, so that was an adult study that was taken in the state of California. Before we go any further, I just want to check in with all of you. Does anybody have any thoughts or feelings about the video we just watched?
And feel free to share in the chat as well. I'll be monitoring the chat.
Great, thank you, Peyton. I mean, for me, it always really helps to put it into context and hear what the patients are actually experiencing. That is the reality for so many of our trans and non-binary patients. And, you know, the patient who was presenting, who identifies as transmasculine, you may have seen him, he was the second patient on the screen. And he talked about how in America, it's becoming more and more important for him to be cis passing. So cis passing, CIS passing, that it refers to passing as somebody that is cisgender, right? So a lot of times passing has a really negative connotation, right? There's this kind of mindset and attitude like, oh, why do you need to pass? Why is that so important? Why can't you just be who you are and present who you are? And, you know, that would be remarkable, right? I deeply and sincerely wish that we lived in a world where it was safe for transgender and non-binary folks to exist and to go about their day and to look however they want, to move however they want. And in some very, very small pockets of liberal cities, you know, even San Francisco, people have that opportunity. But the reality is that for so many of our patients, even in the Bay Area and within Northern California, they don't have that opportunity. So being cis passing means that they can feel like they're safe in certain environments, that they can walk into the bathroom, that they can walk to their car late at night, that they can travel, that they can be comfortable in different environments. And so it really does become this essential concern, especially when when a patient is having to navigate which restroom they use based on how masculine or how feminine they look on that given day. That's a really, really tough situation for somebody to be in. So that for me is always what I kind of notice when I see that video. So I want to then talk a little bit about the
Oh,
primary.
Monica, sorry. We just did get a few comments in the chat, and it did say, it's heartbreaking to hear this. Unfortunately, very relatable experiences in the video. And then I enjoy that it highlighted the different ways people think about this, as well as it surfaced that it can be real threats of harm. I've experienced this personally a lot, even in a place like SF.
Yeah, thank you so much for sharing that, especially your last comment, Siggy, because that is the reality, right? And so many people have this feeling, they're like, oh, well, we live in San Francisco. Isn't it safe for people to be whoever they are? And it's like, you'd think it would be, right? Like, you know, we've been the leaders in this care for so long. The city has been so progressive and amazing in so many ways, but it's not safe, right? These are San Francisco patients. So these are Bay Area people that you just heard from. And these are the realities that they're facing. And another thing to highlight is that so many of our trans and non-binary patients are living in poverty as well. So typically TGNB folks are living at a rate of poverty that's double the national average. And so that also creates a lot of barriers to access when we think about housing, when we think about safe spaces, when we think about the ability to buy clothing, right? To buy cosmetics, to learn certain things, to exist in certain environments where they may be able to receive access to certain coaching. So that's one of the reasons why we're having this conversation with you today. And we really think that gender expression care is an important thing to bring into the healthcare system. So when you look at this image, you can see the traditional healthcare model, and it's wonderful, right? Like it treats so many really essential and huge components of dysphoria. So surgeries, mental health, hormone therapy, these are really, really valuable modalities of care. But gender expression care is an opportunity for an individual to communicate who they are to the world, right? They can communicate this stylistically. They can communicate this through gender affirming hair, makeup, wardrobe, movement, mannerisms, all those things that if you are a cisgender person in this room and you have a gender identity which aligns with your assignment at birth, and you were socialized to do and learn, you know, as a kid, throughout your teens, you had family members that you were emulating. A lot of these things are components that our trans and non-binary patients haven't had the opportunity to learn. And it's a missing component to their ability to fully just express themselves to the world around them. And so that's what we are bringing in. And we're looking towards how we can further promote that care and help people understand that this is really important and meaningful, and it's effective. And you're going to see just how effective it can be in a few minutes. Let's go on to the next slide. So what is gender expression care? This thing that you are all here to learn about. So gender expression care is professional guidance and practical support of social transition for individuals experiencing gender dysphoria, offering immediate, non-invasive interventions to optimize transition-related medical and surgical care. So this is not something that is invasive, right? This is not something that requires any wait times. This isn't something that requires a patient go under general anesthesia. This is exploratory. This is effective. And these are tools that patients can use in real time, and they can use these things to express themselves as soon as they feel ready, which is really profound. So these are some of the components of gender expression care. So again, gender affirming wardrobe styling. If you're a cisgender person in this room, imagine having to shop in the other clothing departments, right? So if you are typically shopping in the women's department, imagine you have to go and you have to shop in the men's department. So you know what your neck size is if you're buying a dress shirt. Do you know what your sleeve length is, right? Do you know what your waist size, your inseam is going to be in pants? I can answer that question for myself personally. I wouldn't know that answer if I'm shopping in a different department. For our trans and non-binary patients, they don't know those answers either, right? And they don't necessarily have family members or friends that they can ask these questions to. And so what we've discovered is that a lot of our patients are in fact asking their doctors these questions. So that's just one area, the gender affirming wardrobe styling, just one example of how being able to coach patients in these things can be really helpful. It's already such an overwhelming time where an individual is learning so many new things. There's so many components to care. It can just be a point of relief. Then we have gender affirming movement and exercise, also incredibly valuable when we think about how we communicate ourselves to the world. Like, what does it mean to gesticulate, right? I speak with my hands a lot, and you can't see them because they're down here just under the frame. But I often feel like, without my gestures, I feel much less me if I'm trying to communicate. It's a big part of who I am. Then there's our movement, right? There's how we walk, there's our gait, there's our posture, there's how we hold ourselves. Then we have updating legal documents. This can also be really, of course, overwhelming. Gender congruent voice therapy, right? So working with speech therapists and helping our patients to find a voice which aligns with their gender identity, asserting their pronouns, coming out, understanding their surgical options, so what is available, and also communicating their desires to surgeons. This becomes a really practical option for our patients that are non-binary, in communicating their desires to their patient or to their surgeons, because it's really not enough to go into the surgeon's office and just say, oh, I want to be more masculine or I want to be more feminine. It really is helping the patients understand that there are so many iterations of femininity and masculinity, and giving the patient the voice, like giving the patient a voice and an opportunity to ask themselves, how do I want to express myself to the world, right? And to really feel that sense of autonomy around their self-expression, which for so many trans and non-binary folks, they just haven't had the opportunity to do. And then gender congruent hairstyling, right? So if you're growing out your hair for the first time, or if you're getting a gender affirming short haircut, how do you communicate your needs? How do you even know what your needs are, right? Again, that patient, the trans masculine patient that was in the video, he mentioned that you could get a short haircut if you wanted to look more masculine, but if you go to the wrong stylist and that stylist is a bigot, you might walk out with a pixie cut, right? What does that mean for somebody that is trying to express their gender identity? And why is it so profoundly painful when they don't get what it is that they're looking for, right? And it's because it highlights that feeling of dysphoria. It takes an individual who's already feeling dysphoric, already feeling that they don't have, that they're not able to express themselves in the way that they desire. And it's confirming that, right? So it's the opposite of creating a moment of gender euphoria. So we really want to be able to teach our patients how to advocate for themselves and how to communicate their desires to outside providers, just even in that space. And then finally, gender affirming cosmetics. So when we think about looking at even like a simple image, right? Like so many of our patients, they are, like everybody else, they're on social media, they are looking at Instagram, they're looking at TikTok, they're looking at all these different platforms and they're seeing images of people. And so often they're not necessarily aware of what is makeup, contouring, highlights, lighting, pose, posture, versus what are the actual features of somebody's face. And really so much can be done with gender affirming cosmetics. This to me is a huge area, especially when we think about the value that our patients feel after they have gender affirming facial surgeries. Gender affirming cosmetics is a remarkable stopgap. So if you have a patient who is on a wait list for gender affirming facial surgery, or they're contraindicated for that facial surgery, giving them a place where they can learn about gender affirming cosmetics can really allow them, again, that feeling of autonomy, giving your patient control over what they look like, saying, hey, I know you're waiting for that surgery, but here's a way that you can create this look without surgery, right? And great, if you have surgery afterwards, it's going to be that much better. But are you looking to cover the shadow of facial hair? Are you looking to refine your features? Are you looking to masculinize your jaw, feminize your jaw? Gender affirming cosmetics really can do a lot. And this is a really special place and something we see the patients really enjoying and feeling very empowered by. All right, we can go on to that next slide. I'd love to do just quick breakout groups. Maybe you can each just take even only 4 minutes and maybe discuss with your breakout group, what ways you communicate who you are to the world, right? Like, how do you do this through your own gender expression? Is it through your mannerisms? Is it through a signature piece of clothing, jewelry, makeup, hair color? And how would you feel if you weren't allowed to do that thing or speak that way or wear that? Also, I'd like to add another question. Who taught you how to do those things? When did you learn? So if we think we have time, let's go ahead and do a breakout room. But if not, if you just want to volunteer and put your answers in the chat, that works too.
I think we have time for a breakout room. So we'll do 4 minutes and I'll go ahead and start them now.
Awesome. Thank you, Peyton. That was so fun. I didn't get to join a breakout room before, so thanks for putting me in one, Peyton.
I agree. I was like, oh, I'm gonna take this opportunity to talk about this as well.
Yeah, I loved it. So would anybody like to share a little bit of how they communicate their gender identity to the world and how they communicate just who they are to the world?
If no one else is willing to speak up, I guess I will. I talked a little bit about some of the ways in which I shape it. And one of the things that I mentioned is that, like, I'm presenting slightly more masculine right now. This is a way that I typically interact with work. It's not just the clothing that I'm wearing, but it's like the fact that I often don't bother with makeup for work. Not that it isn't a thing that I do sometimes do, but it doesn't feel important to me in this context to be describing or showing that off, but that also does depend a bit on the context. I do a leader on the Pride ERG, and so, like, for Pride ERG events, I show up dressed a little bit differently than I do for non-Pride ERG events because I want people to see that representation. But it's more than just that. Like, I'm more direct, my voice is lower. There are ways in which I talk to people that is different, that's more sort of matter of fact, or perhaps on the masculine side, depending on how you view things, that is really catered towards that. That's just very different from how I am in my social groups, but not just in the social groups, but which specific social groups, right? There are some groups that I know that are more masculine or more feminine or more, these different energies. And so I kind of tailor myself towards that, or I just kind of find myself naturally doing that.
Yeah, it's great to hear you bring up the fact that, like, we all have different kind of personas and ways of sharing ourselves with the world in different environments too, right? So, like, if you all think about, what would you wear to a party? Okay, well, that's an environment where you might feel like you're wanting to fully express yourself versus, what you would wear to a board meeting. So it's a very kind of different versions of self-expression. And we're kind of we're making these choices every day. And, somebody in my group, I think it was Alma, she brought up the fact that she hadn't really thought about the fact that these are things that she was taught, right? And she was like, oh, I just felt like I just like kind of had these things. And that's always kind of an assumption that we make about trans people. A lot of the time we're like, oh, if somebody identifies as feminine, won't they just know how to do these things? If somebody identifies as masculine, won't they just know? And it's like, no, not at all. These are things that we're socially taught, right? Like nobody just knows how to put makeup on. Nobody just knows, what is an occasion appropriate work wardrobe for somebody that's feminine or masculine or sizing. These are all things that we learn. And a lot of times we're learning them when we're teenagers, right? And these are things that we're able to explore and experiment with, right? And so if some of you think about your, maybe your late teens, early 20s, you may have had different haircuts or styles, living styles, and it's all about sort of finding what fits and finding what aligns with your self-expression, right? With that point of identity. And for a lot of our TGNB folks, they don't have the luxury of time, and they don't always have somebody that they can go to ask these questions. And I think that is really the purpose here, is that by developing programs and by understanding that gender expression care is an essential component to transgender care, we can start delivering this type of care in a way that is gender affirming to this patient population, and really kind of give them that space to explore. So when I built this program with Kaiser Permanente, we went ahead and we interviewed our clinicians and we interviewed our patients. We really wanted to make sure that everybody's needs were being met by this program. And so for our clinicians, they wanted the patients to be more actively involved in their care plan and to have a clearer understanding of what the patient's goals were, as well as to align the care plan with the patient's social transition goals, right? Because if you have a patient who is socially transitioning, their goal is to socially transition in, let's say, 6 months, but they have let's say they have a facial hair that's similar to Blaze's, right? Well, that's not going to take 6 months to clear, right? Like they're not going to be, maybe the patient is comfortable having facial hair and presenting the way that they want. But if the patient's not comfortable with that, then that's going to be a barrier to their ability to express themselves, right? So even if they start the hair removal process, okay, they're definitely not going to get through that in 6 months. It takes much longer than that. And so how can we teach that person to, if it's essential for their self-expression, for their self-identity, for their safety, how can we teach that patient to cover their facial hair growth with makeup, with cosmetics, right? Can we do that? Is that a way to align that patient's plan with their goals and to allow for social transition and allow for safety? These were things that we were considering. And then, of course, to deepen the insight into the patient's transition experience. So really to expand upon how we understand that patient's goals, right? Instead of having that 6 to 12 minute appointment with the patient, really being able to dive in and have a much more robust concept of what that patient's needs are. The patients really wanted a safe space to explore their self-expression, right? Not everybody has an environment to do this. In fact, many, many patients do not have an environment to do this. They don't necessarily have a place that they can ask these questions, and they're going on YouTube a lot of times to get these answers. And the challenge with that is that you don't know what you're going to get. If a patient is watching a cis person style their body or do makeup on their body, oftentimes the way that that person is styling themselves is actually going to either feminize or masculinize, right? Kind of in the undesired direction, that person who has a different assignment at birth, right? So it may unfortunately take them into the wrong direction where they may feel even more gender dysphoria after looking in the mirror using those techniques and tips. So we really want to make sure that we are treating our trans and non-binary patients in the same way we would treat any of our other patient populations. Like we're not telling our, like our PM&R patients, we're not telling patients that are doing physical therapy, oh, go on YouTube and find some exercises, right? We're connecting them with physical therapists and we're really giving them that care. And so a problem with transgender care up until this point is that, we have been focused on those 3 main attributes of transition care. Those are essential, those are valuable, they're meaningful. But we need to think about what else we can do, especially at a time where transgender care is being restricted, right? It's becoming even more important to have alternative methods and to really take a holistic approach to this patient population. So again, for our patients, they want to increase their social skills within their gender expression, and they want to increase their comfort and confidence. And really, this is a huge one. They want to establish community, right? So when you think back to when you were socially expressing yourselves and exploring yourself in high school, in junior high, in college, were you doing it alone? No, you weren't. Like, your friend was dyeing your hair in their bathroom, and your mom was shouting because you've just dyed the sink purple. And so those were moments that you were doing with a friend, right? You were going to the mall, you were going shopping, you were, going back and forth and seeing what fits. Really adds so much value for this to be a social experience. For a lot of our patients, the workshops are the first time that they've ever even met another trans or non-binary person outside of just like occasional like internet messages, right? So this is a really, really cool moment. This entire program that we've created is virtual. My workshops that are outside of KP are also virtual. And again, just giving people a point of connection. So this is a brief snapshot of what the syllabus looks like. All of the syllabuses are tailored to the patient's individual needs. So each cohort is mixed pronouns. So that means we have patients using she, her, they, them, he, him, she, they, he, they. So really all of the different pronouns and some new ones, right? Because occasionally new pronouns are added. And more often than not, these are the topics that we cover. So the big ones we hit are the gender affirming voice, hair, makeup, movement and mannerisms. And then what makes this special is that vision creation. So you'll see on week 1, we give that's the only kind of homework assignment we give. And that is an opportunity for the patients to finally ask themselves, how do you want to present yourself to the world around you? Because for someone that's trans or non-binary, more often than not, that is a question that they have never had the luxury of asking themselves. So if you are cisgender and if you are hearing this presentation, know that the fact that you've been able to ask yourself that question time and time again and to explore your presentation is a privilege. And that's a privilege that many of our patients have not had. Okay, so super important that we don't just make assumptions about how this care can help our patients, but actually vet it. And so early on, we started giving our patients the AOQ and the QOL. We were, doing those pre and post mental health scores. And for the mental health scores, you'll see that graph on the left. It really made a pretty significant improvement. So the AOQ is on a scale, I want to say, is it 27? And so right in that mid-range, so not severe depression, but sort of that like mild to moderate range, we're really seeing a pretty remarkable decrease, right? So very much in the poor physical health, we're seeing those number of days reduce, and then also in the poor mental health space, as well as daily activity interference, we're getting a little reduction there too. So very cool to see this improvement. The mental health scores didn't change so much. We had about a 1-point drop with the depression score, which is, again, pretty significant when we're thinking about reducing that mild depression. And then the anxiety score did not change very much. But overall, we're pretty proud of this, and this is quite promising. We've given this to, I want to say, 200 patients now, and we plan on doing more and more research as we go on. So then we created something called the Gender Expression Measurement Tool, because the AOQ and the QOL are great, but that's not really what we were trying to learn and understand. So the GEMT is a novel tool which is intended to measure the patient's feeling of confidence within their social gender expression before and after any intervention. So what does that mean? So you heard the patients talk about how they are delaying their social transition because they don't know these things, right? And they don't feel comfortable expressing themselves. So we really wanted to understand if the gender expression care workshops were helping patients actually function in their day-to-day lives, right? Actually increase their confidence. So some of the questions would be like, how confident do you feel wearing clothing or wearing makeup or wearing a hairstyle that aligns with your gender identity at home, with your friends, with your family, at work or school, with strangers, and it would go through each of those different domains. And if we go to the next slide, there's an example of the GEMT. So this is just a little snapshot. So then you can see each of those different domains, and it's on a, you've got that classic 5-point scale. Okay, so this is very, very exciting. So at this point, we've given the GEMT to, I want to say like 150 patients. So on the patients before starting the workshop, so this was like day 1 of the workshop, we give this to them right at the beginning. You see the red, and the red are pretty low scores, right? So those are patients that aren't feeling a lot of confidence, right? So we've got a real lack of confidence in voice. We've got like the overall scores are pretty low, and hair and makeup is also pretty low, asserting pronouns. And then after the workshop, we see no more red, which means we saw a pretty significant improvement. Again, even when you look at this and it's like a 2-point improvement, that is a lot. This is a 5-point scale. So that is quite significant. And we are so proud of this. And this is also helping us so that we can see areas in which we want to do more work in, like what we see in the movement space. We're not really seeing those numbers tip up quite as much as we want. So for me, I'm really working on developing that module so that it can be clearer and actually give the patients some tools that they can carry on into their day-to-day. So this is just a snapshot of some of those outcomes. So at the end of the workshop series, patients expressed increased confidence in hairstyling and use of cosmetics, as well as in their overall gender expression. They also expressed increased confidence in their work and school across all domains. The GEC patients experienced improved depression scores and quality of life after completing the workshops. And when we asked the patients if they feel the workshop should continue, they all stated strongly that they feel that the workshop fills a critical gap in their care, and they really would like it to be available to all transgender and non-binary healthcare members. And this is something we really love to see, right? The patients feel very strongly that this is important. So we always get the question of if we offer this for our pediatric patients, and the answer is yes. It is a very new program. We are currently only seeing patients who are between 12 and 17, although I would say the majority of the patients that join this workshop are between 13 and 16. There's so much evidence supporting, linking social support to better mental health outcomes among transgender adolescents and adults. And it's really valuable. So this is a pretty unique program in that it includes the parents and the kids together. Peyton, if we go on to that next slide, please, we can see that. So this includes the parents and the patients, and each of the weeks we mirror the topics. So I lead it as the gender expression specialist, but the co-leader is Dr. Alice Turner. She's a pediatrician, and she's also the parent of a transgender kid. And so what that does is it really creates this marvelous bridge, right? You have great engagement. You give the parents a safe space to speak. You give the kids a safe space to speak and to ask questions. We bring on guest presenters, a speech therapist. We also bring on a speech therapist for the GEC Adults Workshop. And in this one, we bring in another doctor who is also a pediatrician. They're a pediatric gynecologist and the parent of a trans kid and has a transgender sibling. So very much a member of the community and an ally. And they talk about different changes that the patient may expect or experience in their body and how to navigate those feelings. The purpose of this workshop and the reason we combine it with parents is really because we know that the parents are the ones that are supporting their kids in that journey. And we really want to make sure that the parents feel informed and educated in how to do that and that they receive care as well. So the first hour is the kids, and then the second hour, we speak to the parents, and we do this kind of right before dinner time. And we hope that a conversation takes place over that meal. And we are just super proud of this. We are on our 3rd cohort right now, so it's still very early, but we're seeing some pretty great results. So these are some of the outcomes. We have parents say that The gender expression care workshop helped them to understand what their child was going through. Again, that's a 5-point scale. They gave it a 4.1. Gender expression care helped me to understand what I could do to support my child. They gave it a 4.6, which is awesome. Gender expression care helped me to understand options we had for helping my child with their transition. They gave it a 4.7. So again, just really seeing the need for this in the community and understanding the value the gender expression care can give to not just our transitioning patients, but also to the people that are supporting them. So finally, I want to leave you with some tips. So since you don't yet have a formalized gender expression care program, you can help your patients with just some really simple tips. So if your patient is expressing that they feel like they're too tall, right? There are surgeries, but they're extreme, and I don't think most people would recommend them. So if your patient is feeling that way, like they're too tall, too short, you can explain that by wearing monochromatic silhouettes. So that means wearing, the same color top and bottom. They can create the illusion of more height, right? And lengthen their appearance. And subsequently, you can do the opposite, right? By color blocking. So that means wearing different colors, right? So wearing a different color on top, a different color on bottom, even a different color shoe. And that kind of breaks the eye up. And every time we break up an image, it compresses. And that works vertically and horizontally. So you'll see that also with scoop necks and V-necks, which can reduce the appearance of width, right? So if you have a patient who's maybe trans feminine and they are assigned male at birth and they're saying that they feel like their upper body is too big, too prominent, they feel self-conscious about it, you can encourage them to wear V-necks or scoop necks, and it will kind of reduce the appearance of broad shoulders. And then for your patients that are trans masc but feel that they want to have broader shoulders, they can do crew necks or something that's higher necked, as it will create a more continuous line, which will kind of exaggerate the width of shoulders. And then it's also important to remember that you never want to make any assumptions about what a patient might want. So sometimes you'll have a trans feminine patient or a trans masculine patient. Certainly with your non-binary patients, you want to ask questions and really make sure that you're delivering advice that aligns with their personal goals. But a lot of times you'll have patients that want to highlight features that you may perceive as masculine, and that may be counter to how you're expecting them to present. It's really important to hold space to that and just deliver guidance based on how the patient directs you. And then also we've got lighter desaturated colors, which create the illusion that something is larger, whereas darker or more saturated colors, which is, there's a typo there, it should say saturated colors, have a minimizing effect, so will make things appear smaller. And then since we are at the 1 o'clock mark, I will send you off with these tips. You can read through these on your own, but I will stay if there are any questions. I'm happy to answer.
Thank you so much. We so appreciate your time and expertise in this really beautiful subject that you speak to so articulately. I know folks are going, and Peyton, if we want to go ahead and stop the recording.